Hello, my name is Dr. John Naranja, and I'm an attorney here at the Diller Law firm. I've been asked to talk about the common injuries that we see in our practice. One of the reasons I've been asked to do that is because prior to becoming an attorney here, I was a practicing physician. I went to medical school at Georgetown University School of Law in Washington, D.C. I did an orthopedic residency at the University of Pennsylvania in Philadelphia, and then I was in a general orthopedic practice for approximately 12 years. After that, I've seen multiple patients. I performed a number of surgeries that are quite common that we see in our clinical practice. So the next thing I'd like to talk about are injuries to the knee that we commonly see in our practice. So when we think about the knee, it's very important to understand the anatomy, more specifically the internal anatomy of the knee, in order to understand what kinds of symptoms and injuries that can occur after either a fall or a motor vehicle collision, those types of mechanisms. So what we're looking at here is a model of the knee. We've taken away all the soft tissues, the skin and the muscles, in order to be able to look at the knee bone and some of the internal structures of the knee. And so just to get your bearings, what we're looking at first is the front of the knee. And when we look at the front of the knee contains a kneecap, and that's what I'm holding here in the front. When we then look at the side of the knee, the lower part of the leg is actually made up of two bones, the tibia and fibula. And the fibula is the smaller bone here, and you can see that on this side. The fibula, or the actual shin bone, is where my finger is pointing here. And then the upper part of the knee is formed by the femur. Also, people think of it as the thigh bone. And then when we look at the back of the knee, here we can see a little bit less in terms of structure, but that's where all the important blood vessels and nerves that go into the knee and lower leg are located. So now let's take a look at the internal part of the knee. If I pull the kneecap aside, that's where some structures that we commonly see that are injured. When I pull the kneecap aside and I kind of flex the knee, so whenever you bend your knee, think of it, most people like to think about the knee as kind of a hinge joint. It bends just back and forth like the hinge on a door. So if I was to open this hinge up, there are structures that are vulnerable to injury, especially when you're in a traumatic situation. So the first thing I want to look at here are these kind of brown or tannish structures located on the lateral and medial side of the knee. Those are called the medial and lateral menisci in plural. When you think about the meniscus, it's a shock absorber for the knee. It helps to absorb shock, it helps to lubricate the knee, but it's also vulnerable to injury, especially with any kind of compression or twisting that puts pressure on the meniscus itself. Also very well known from if you follow any kind of sports is something called the ACL, or the anterior cruciate ligament. And again, I'm going to open the knee up, and you can see the anterior cruciate ligament here at the tip of my finger running from the top to the bottom. The anterior cruciate ligament is responsible for helping stabilize the knee. So in other words, whenever you pivot or make a turn, that anterior cruciate ligament allows you to turn and not let your knee come out of place. If that ligament is ruptured, then a lot of people will complain not only of pain and swelling, but they'll also have what's called instability. In other words, if they take a pivot, what will happen is a part of the knee will come out of place. Anterior cruciate ligament, or the ACL, is located on the internal aspect of the knee, and that's responsible, again, for helping with keeping the knee stable, especially during pivoting activities. If you're looking at the knee from the front, this is a right knee. So the inside of the knee is located on this side, the outside is located on this side. So when we start to think about injuries that occur on the inside, or what's called the medial side of the knee, there's a ligament that runs from the thigh bone to the shin bone, and that's called the medial collateral ligament. That's often injured if your knee gets pushed into a direction where it's pushed to the side. So if I'm going to show you from the front, if the knee gets pushed from the side, that ligament is vulnerable to getting torn and injured. And then at the same time, there's also something called a lateral collateral ligament, which is located on this side. And again, that's susceptible to being torn if the leg gets forced into this kind of direction. So the bottom part gets pushed towards the inside. Now, when we talk about evaluating these types of injuries to the knee, usually you'll see an orthopedic surgeon. They'll do an evaluation with a history, asking you what happened to cause your knee to have an injury. They'll do a physical examination, actually doing tests to determine the integrity of how stable your knee is. Then they'll do x-rays to make sure there's no identifiable fracture or other degenerative changes. And then finally, in order to evaluate those particular soft tissue injuries, they'll do an MRI in which they'll actually able to identify any type of tear. Remember that tears can be analogous to, or the way to think about it is that they're analogous to a rope. And if a rope is torn, that's pretty similar to how a ligament can be completely torn. Remember, there's also degrees to which a ligament can be torn. It can be stretched, sometimes called a grade 1, or it can be partially torn, sometimes called a grade 2, and then it can be completely torn, in which the fibers of that rope are completely apart, or sometimes called grade 3. If you have those kinds of injuries, the treatment really depends a lot on your symptoms. Often people who have meniscal tears, either medial or lateral meniscus, will have some kind of catching or grinding. It's almost like as if there's a pebble in your shoe, because that tear does not allow smooth motion of the knee back and forth in that hinge type movement. If you've torn your ACL, what you'll probably see in terms of symptoms, you'll have some instability where the knee actually feels like it pops out of place whenever you take some kind of pivot. With regard to a medial collateral ligament or a lateral collateral ligament tear, what you'll also feel is some instability, especially with putting some kind of stress in one direction or the other. Now, the treatment for those kinds of things is usually for a meniscal tear. If it's a tear in an area that does not have a good blood supply, then it can be treated with what's called debridement, or taking out of the tear with an arthroscopy. If it's a repairable tear, meaning it's an area that has good blood supply, you can actually suture the two ends together where it's torn. Usually the medial collateral ligament can heal on its own. It doesn't require any kind of treatment. The lateral collateral ligament needs some kind of evaluation to determine whether surgical intervention is required. Now, ACL injuries, because of their location inside the knee joint, where the nutrition is all from the intravascular synovial fluid, not from necessarily a blood supply, usually those can't repair on their own. And so treatment options for those, as far as surgery, are to do actually a reconstruction, meaning you can actually remove the torn portion of the ACL and substitute with another part of the body that will take the place of the ACL function. Most commonly, the areas where grafts to do a reconstruction are taken, or it can be taken from the patellar tendon, or they can be taken from the hamstring, or you can actually use an allograft, which is taken from a cadaver, in order to kind of reproduce the anterior cruciate ligament. So obviously these reviews can't discuss every single aspect of anyone's injuries, but hopefully this overview has helped you gain a better understanding of the anatomy, how injuries can be diagnosed, treatment options, as well as the future prognosis. Thank you for your attention.